Hello, I'm Richard Bircher. I'm a GP working at Lockside Medical Centre in Stalybridge.
Hello, I'm Joanna Bircher. I'm also a GP at Lockside Medical Centre.
We thought we'd give you another update on what's happening about the NHS COVID-19 vaccination programme, which is rolling out across our local area.
As many of you know from our previous video, the week before Christmas we managed to immunise almost all of the population of Stalybridge, Mosley and Duckingfield that are over the age of 80. And that programme's being run from the George Lawton Hall in Mosley, and it's run by our primary care network. And the primary care network is a group of 9 GP practices across Stalybridge, Mosley and Duckingfield who are all working together.
In addition, we managed to immunise nearly every single one of our residents of care homes, which is great news. Most of their care workers and an awful lot of NHS staff. So things are going really well.
Yeah, we're particularly pleased about being able to protect that really vulnerable group.
At the moment, so today is December the 8th.
January.
So January the 8th. We're busy, our amazing jabbers are busy at the George Lawton Hall as we speak, immunising people aged 75 and over.
And we just got news that they managed to vaccinate 677 people today, which we think is fantastic. We wanted to tell you a little bit also about the all the controversy you've been hearing in the news related to the second dose of the vaccine and how the NHS has asked us to prioritise first doses. And well, we made a decision across our locality of Tameside and Glossop that anybody that received their first dose of the vaccine prior to the 31st of December and had already booked in and been promised their second dose, we would actually honour that promise. But anybody that had received their vaccine after the 31st of December would just get the first dose with a possibility of a second dose at some point in the next 12 weeks.
Now the timing of some of those second doses unfortunately has changed a bit because our predicted delivery of new vaccines early next week has been changed. So if you were about to receive a second vaccination on the 11th, 12th and 13th, then that's changed to later in the week. But every single person who has an appointment will be contacted personally by their practices to rearrange those appointments.
Yeah. We wanted to ask you a bit of a favour really. As you all know that the general practice is very busy at this time of year, managing just normal day-to-day illnesses that people have, and so we're taking quite a lot of phone calls. What we're finding is that we're also taking lots and lots of phone calls related to the vaccination programme, and some of those may be really important, but many are people possibly just ringing to check when they might be getting their vaccine, or ringing to check is it really at the George Lawton Hall, or just all sorts of queries that you could possibly just have answered in an alternative way, and also specific questions related to the vaccine. Or concerns about the vaccine, when all that information is available on all the government websites. So we're going to kind of ask if you can possibly help it not to ring practices, the GP practices, to ask these questions, and try to access that information in a different way, either online, or if you're not able to do that yourself, possibly ask a friend or relative to do it for you. That would be really helpful.
Really helpful, thank you. And then we have one more bit of good news. This weekend we are receiving our first batch of the Oxford AstraZeneca vaccine, and this is a real game changer because this vaccine can be stored at normal fridge temperatures. It's much more stable and we can carry it around the community, which means that we can take it into people's homes. So there's an awful lot of people who are vulnerable to nasty COVID infection who can't leave their home because of their disabilities, and so we can take the vaccine to see them. So from next week, the housebound patients are going to start receiving their vaccine.
And it's those over 75 that we've got doses for first, because all the doses are being delivered to us in a staggered manner. So if you know that you are vulnerable and at home, but you're under the age of 75, I'm afraid you just might be waiting just a little bit longer.
So thank you very much.
Yeah, that's our update this time, and we'll speak to you all again in a week or so.